We've been highlighting different areas of the Patient Care Pavilion here at Good Samaritan University Hospital, and today might be the biggest, the emergency department. How big, you ask? About the size of a football field. Joining me now is the chairman of emergency medicine at Good Samaritan University Hospital and the chief of emergency medicine for Catholic Health, Dr. Chris Raio. Dr. Raio, welcome.
Thank you. Thanks for having me.
We talked about how big and beautiful this ED is. We'll get to the size in a minute, but first we want to talk about the location. This building has moved from its previous location. If you could just please talk about that move, why it was done, and how it's going to improve the efficiency of care.
Sure. So obviously we're super excited to be moving into this big, beautiful space. We consider the emergency department the front door to our home and to our hospital, and now that front door has moved front and center to Montauk Highway, so better patient access, better visibility. We're super excited about that. So with this expanded space, we have dedicated pods to treat certain types of patients, but all private rooms, which will be a lot more comforting to the patients and to their families.
Good Samaritan University Hospital, again, the first level 1 trauma center on the south shore of Long Island. Excellent trauma services here at Good Samaritan. And there was also some changes that you touched on in terms of not just moving around the trauma area, but also the complementary services, such as the surgical suites as well, to, again, improve the quality of care.
We have a very sick patient population, and our new 10-bedded trauma critical care area really gives us the space, the technology to treat those really critical patients. When you walk into that area, it's probably most exciting for us as emergency medicine physicians. It's really eye-opening to see that space, to see the technology. And by the way, we also have a dedicated expanded imaging center with 3 dedicated CAT scanners, which I don't know of any emergency department in the country that has that centrally right in the emergency department.
Moving over to peds, as a parent who lives in this area, I have spent more time than I can remember in the pediatric emergency department here at Good Sam. That's getting a new look as well. The existing PTD was fantastic, but again, it's about just raising the bar and continuing to improve the level of care, this time for pediatric urgent care.
You know, when patients and particularly kids come to us, they're not usually in their best state. They're not their happiest. They're anxious, they're nervous, in pain, concerned. You know, to have these big private rooms for the kids and their families, we think will really be a benefit to the patients and the community.
That is fantastic news. Again, we're talking about the new emergency department here at Good Samaritan University Hospital. I feel a little bit like a game show host because, oh wait, there's more. There's also some benefits for our EMS partners in the community to make their jobs easier. And again, it's all about improving that patient care. Could you talk about some of the enhancements that were made to help our EMS partners?
They're really part of our team. So we've designed an ambulance bay with multiple 7 spots now, so that's expanded. The entranceway where they'll come into the ED separate from the regular walk-ins. We'll be able to get them in and out quicker. Everything, again, with this design was aimed at the patient, but also our teammates, our EMS partners.
That's fantastic news. Dr. Raio, thank you so much.
Thank you.
I'm joined now by the president of Good Samaritan University Hospital, Dr. Justin Lumby. Dr. Lumby, you guys see nearly 90,000 patients a year in the current ED, so this is a special space. Could you just talk how important an emergency department is to the community?
Yeah, this is the front door to the hospital. We see every type of emergency here, from cardiac emergency to neurologic injuries to trauma to pediatrics. So this is where patients get their first care. So you want to do the best delivery that you can right here. And that's why this is so special, because it's delivering not only excellent health care, but state-of-the-art facility to provide that care.
All right, Dr. Lumby, thank you so much. Thank you for joining us as we continue to take you behind the scenes and showcasing this beautiful new Patient Care Pavilion. We'll see you again next week with another update.